Hey, it's Dave Brown here, host of Now with Dave Brown on AMI. Check out this latest highlight from the show. Concussions in youth sport are a growing concern. An estimated 200,000 concussions occur every year in Canada. Children and youth are affected primarily. Dr. Roger Zemek has more insight. He is a concussion expert at the Scientific Center at 360 Concussion Care. Dr. Zemek, welcome to the show. Thank you for making some time today.
Thank you so much for having me, Dave.
Dr. Zemek, it really feels like in the last decade, there's been a lot of mainstream conversation around concussions and a lot of advancements. What are the main areas considered when diagnosing a sport-related concussion?
Well, one of the things, Dave, that I also do in addition to being a concussions physician is I have a background in pediatric emergency medicine. And I do know that it is important that we make sure we rule out any of the things that require things that may be different than concussions. So some of the initial assessment we do as a physician is to make sure that there are no red flags, as we call them. Those may be signs or symptoms that may indicate a more serious brain injury that requires x-rays, CTs, or even surgery if there is bleeding or swelling in the brain. So what we typically do is we review the injury. What was the mechanism? Was it a direct blow to the head, or was it a blow to the body that led to the shaking of the head? That may also indicate that there's been some sort of neck injury as well. Next, we go over some of the early signs. Was there a loss of consciousness? Was there any sort of amnesia, which means they may not remember? Then we also, again, see is there any other things that may indicate a more serious injury with regards to the rest of the body, and any weakness or tingling of the hands and feet. Was there any worsening confusion or things that may indicate an emergent transfer to the hospital is done? Fortunately, those are pretty rare. And most of the time, kids do not have those more serious injuries, and we then proceed with the evaluation for a concussion.
What are some of those signs and symptoms within the time frame of a traumatic blow to the head?
So usually, Dave, the symptoms occur within seconds to minutes. In those cases, children will present with often signs and symptoms across four major themes. So the first domain is physical symptoms. So those may be things like headache, nausea, dizziness. Sensitivity to light and noise is also very common. There may be changes in ways people think, which we also call cognitive symptoms. So those can be things like fogginess, difficulty thinking, difficulty remembering, feeling a bit slowed down or fatigued. You can have emotional symptoms. Some kids may become more frustrated, nervous, anxious. Those things usually present a little bit later just because the initial signs and symptoms dominate. And then usually you see over the coming days that sometimes kids have problems sleeping. Either they're more tired, sleeping more than usual, sometimes having a harder time falling asleep.
Mm. When I say things feel like they've shifted a little bit in terms of mainstream conversation in the last decade, I feel like that has a lot to do with the understanding of the brain that's going on. What are some of the changes in understanding of concussions?
Yeah, it has been fascinating to be living this every day. One of the things I have the privilege of doing is leading the International Pediatric Concussion Comprehensive Guidelines. And I lead a team of over 40 experts from all over North America on these guidelines. And I've been, as said, leading them over a decade. And so many things, you're right, Dave, have shifted. So we used to think rest was key to recovery. And the more we learn that it's that concept of keeping kids in that dark room, no exposure to light, no physical activity till they're symptom free, actually probably may cause harm. So one of the things that my team led and others that are involved in our team has done studies, research studies, in which we encouraged kids to get back doing physical activity earlier. And we actually found that they got better faster. So that is one of the major changes, is doing physical activity that is safe. So I really want to reiterate to your listeners, this is not a free ride to go back to doing a high risk activity in which the child may fall again or collide in another sport, but getting that heart rate up, getting the fresh air, moving the body, getting the blood flowing to the brain, the science does actually show there is benefit. Similarly, getting kids back to school is another thing that has been important in leading to faster recovery. So those are two major changes alone that I'm so proud that our team has been an important part of developing the evidence, and now it's established in the guidelines as well.
I know your area of expertise tends to be a little bit more in youth, but anecdotally, my cousin was a professional fighter and he suffered a few concussions along the way. He eventually retired from the sport. And what he found in his recovery and treatment is a much higher continuity now. It's not just thinking about 1 week or 2 week or 1 month, but about an ongoing effort in recovery.
So you're absolutely right, Dave. We continue to evolve with our understanding, and one of the things I have the privilege of being involved with is 360 concussion care, which is not just pediatric, but it's the entire spectrum of concussion, from youth all the way up to people in their 90s. People not just from sport, but as you may know, Dave, a lot of people can get injuries due to falls on the ice, workplace injuries, motor vehicle collisions, and others. And some of the things that we're learning is it's so important that this is not just a doctor thing only with medication, but there is a whole team to support people following their injury in an interdisciplinary way in which we leverage the expertise and the knowledge of all team members. So for example, occupational therapists are health professionals whose main role it is to support people getting back to work, or if they're a child, getting them back to school. Physiotherapists will do things like work on some of the pain that's sometimes due to muscle spasms or limitations of the neck, because whiplash is so common in all types of concussion, whether sport or other. Physiotherapists can also help with balance and gait, as well as some of the eye movements, because really is very common for people to have problems with their eyes. And then lastly, and I think most importantly, Dave, is the mental health aspect. We know that there's a mental health crisis in our youth and across all Canadians, especially following the pandemic. But what we know is that concussion particularly can impact mental health. And I led a very large study on that, and it's so important to recognize it early and address it early.
One of the other areas that has shifted quite a bit, certainly since I was a young person, contact and collision in youth sports. There appears to be greater mitigation efforts, but anytime you're talking about a collision or contact sport and impact sport, there is the risk of concussions. What is the research suggesting about long-term effects that may force a young person to have to retire from a particular sport at a young age, perhaps when they feel like they're not ready or they don't want to?
Yeah, Dave, this is why it's so important to have personalized care. It's so difficult to make a one-size-fit-all rule, and I have seen hundreds, if not thousands, of youth throughout the years, and most of them with 1, 2, or even just several concussions can still go and continue doing the sports and the activities that they love to do. And one of the reasons I personally am so passionate about this topic is I'll share with your audience, I've had 3 concussions myself. Still was able to become a physician and do what I love to do every day. So not all concussions are going to necessarily lead to long-term problems, but you are right. It is important to recognize that we still are learning so much about what are the long-term changes to memory, mood. We do know that if not properly addressed, there could be higher risks of problems down the road, especially with mental health as well. So first and foremost, I think some of the things that we are learning about for future return to higher risk sports is to make sure that the policies are in place to make sure that the risks of unnecessary injury are mitigated. So what do I mean by that? Preventing that next one is so important. So if there could be rule changes to that sport, we'll pick hockey, for example, if they can remove or delay checking as late as possible, kids can still do the sport they love without having accumulated higher number of concussions early on. Same with even sports that you may not think of as higher risk for concussion. But one excellent recent study that's come out is looking at volleyball. They did a rule change, whereas at warm-ups, if there was just one ball on the court, it was led to further prevention. So to answer your question with regards to sport, I have advised some youth who I have seen, and I don't ever want to disclose any personal information of any of my patients, but I have seen youth with more than 5 or 6 concussions. They do collision sports, such as things like hockey or football or rugby. And I will talk to them and talk to them about what do they love about their sport? What is it that gives them joy? Is it being on a team? Is it being valued? Is it the physical activity of it? And I may say to them, look, you are fast, you are strong. Perhaps track and field, at least for one of your seasons, may be a great alternative for you to use your opportunities to be part of a team. If you're a strong person, maybe you do a throwing event. If you're a fast person, you do a sprinting event. There's so many skills in a sport like that where someone can still get joy on being on a team, but not necessarily expose themselves to a higher risk. But you are right, Dave. There's still much more we need to learn about what are the long-term consequences following concussion. And I think the other thing that science needs to better help us do is come up with what we call objective biomarkers. Those are things that can change with measurement rather than self-report. So some of those things will be things like blood changes. Those things are sometimes even called microRNAs, where your actual blood can change. And you mentioned your relative that was a fighter. There's been a study that shows that the microRNA can change before a fight to after a fight even.
Wow.
So fascinating stuff. And I'm working with some of those team members on a big research project that we've just been funded for by the Ontario Brain Institute to study these objective markers. Things can also change on pictures. These are not routine clinical ones, so your listeners don't expect to necessarily get this in an emergency department or at a clinic. But if you're involved in a research study, they may invite you to do things like an advanced MRI scan to see how the brain connects. And these are really fascinating advanced MRIs to look at how the blood and water flows through the brain and actually leads to see if we can even see the connections within the brain as people think. So those are some of the examples of the objective biomarkers. Also, really neat advances on using infrared cameras to look at to see if the eyes are moving together. Those are things that will better help us understand, is the long-term problems due to still the brain injury itself? Or is it due to the fact that people have had so much missing out and have further developed higher things such as migraine-like post-concussion headache, or have they developed things like PTSD or other problems following their injury that need to be addressed with other approaches, not just the traditional concussion approaches?
Dr. Zemek, you have about a bazillion synapses firing in my brain. I could talk to you for the rest of the hour, but I have to say goodbye to you now. Thank you so much for taking the time today. Let's catch up again down the road and keep hearing about some of the amazing research you and your colleagues are doing.
I would love to. Thanks so much. I too could talk about this all day.
That's Dr. Roger Zemek, Scientific Director at 360 Concussion Care. Do you want to dive into more conversations like this? Watch Now with Dave Brown weekdays at 9 a.m. Eastern on AMI-télé or download the podcasts wherever you listen. Do you want to dive into more conversations like this? Watch Now with Dave Brown weekdays at 9 a.m. Eastern on AMI-télé or download the podcasts wherever you listen.